10. Symptoms of pancreatic cancer that will shock you. Critical warning signs. You might think it's just indigestion, stress, age, a side effect from a new vitamin. But what if that nagging back pain or that strange fatigue you can't shake is actually a quiet warning from your body? Pancreatic cancer doesn't make a grand entrance. It doesn't announce itself with obvious signs like a lump or a cough. Instead, it hides until it's too late. In fact, more than 50% of people diagnosed with pancreatic cancer are already in stage 4. Why? Because the early symptoms are subtle, misdiagnosed, or ignored altogether. And yet, the body does send signals, whispering, nudging, trying to get your attention. This could be the most important article you read this year, because these 10 symptoms of pancreatic cancer have been overlooked too many times, and knowing them might save your life or someone you love. The story of Frank Simmons. Frank Simmons was the definition of stability. A retired mechanic in Dayton, Ohio, he'd worked with his hands his whole life and took pride in being dependable. He was up by 6, rain or shine. He still mowed his own lawn, took daily walks, and was famous in his neighborhood for the roasted peanuts he made from scratch every Saturday. So when Frank lost a few pounds, he didn't think anything of it. In fact, he was pleased. When he started skipping meals, Clara, his wife of 45 years, teased him for finally giving up his sweet tooth. When his back started to ache at night, they blamed it on his old tool bench. But the signs kept coming. He was tired all the time. He slept through their anniversary dinner. His skin began to yellow, subtly at first. He was itchy all the time, scratching at his arms until they were red. And then one morning, he collapsed. By the time doctors discovered the source, an aggressive tumor in the head of his pancreas, Frank had only weeks left. Stage 4, inoperable. The cancer had silently overtaken him. Frank passed away 11 weeks later. No warning, no family history, no second chance. His story isn't rare, and it isn't fair, but it's not inevitable. The earlier pancreatic cancer is detected, the higher the chance of survival. That's why understanding these warning signs is so important. Let's break them down. 1. Unexpected and rapid weight loss. Losing 10 or more pounds without trying should always raise a red flag. In pancreatic cancer, tumors can block the pancreatic ducts, preventing enzymes from breaking down food. Even if you eat normally, your body can't absorb what it needs. Patients often say they just don't feel hungry anymore. This is not just appetite loss, it's a biological consequence of the pancreas shutting down its digestive duties. Look for signs like your clothes becoming loose, your belt needing a new notch, or visible muscle loss in your arms and legs. 2. Jaundice, yellowing of the skin and eyes. One of the few visible signs of pancreatic cancer, jaundice is caused by a backup of bile. The bile duct passes directly through the head of the pancreas. If a tumor grows there, it can block bile flow almost entirely. This results in yellowing of the eyes and skin, intense itching, and changes in stool and urine color. But many people, especially older adults, assume it's a medication side effect or liver issue and never think to check the pancreas. Jaundice should never be ignored, especially if it appears with fatigue or unexplained pain. 3. Dark urine and pale, greasy stools. If your urine starts to look like cola, or your stool turns gray, clay-like, or greasy, it means bile is not reaching your digestive tract. These color changes often happen before pain sets in. The stools may also float and be difficult to flush. That's because pancreatic tumors disrupt fat digestion, leading to a condition called steatorrhea, or fatty stool. These clues might show up in the toilet long before anything hurts. 4. Persistent abdominal or back pain. Pancreatic cancer often causes a unique kind of pain, deep, aching, and located in the upper abdomen or middle back. Some describe it as a band wrapping around their torso. Others feel it during sleep after eating or when lying flat. This happens because tumors press against surrounding nerves and organs, or because of inflammation around the pancreas itself. It's one of the most common reasons patients finally seek help, but by then, the cancer may have already spread. 5. Sudden onset diabetes or blood sugar spikes. The pancreas is the organ responsible for producing insulin. So when cancer invades it, your blood sugar regulation can suddenly spiral out of control. People with no history of diabetes may suddenly develop it in their 50s, 60s or 70s, with no weight gain or lifestyle change. Others with controlled diabetes may suddenly find their condition worsening. Doctors now view sudden onset diabetes in older adults as a red flag, and in some cases it leads to a pancreatic cancer diagnosis. 6. Nausea, vomiting, and digestive distress. When tumors block the exit of the stomach, food can't move into the intestines. This leads to a range of unpleasant symptoms: constant bloating, burping, vomiting undigested food hours later, and an uncomfortable feeling of fullness after just a few bites. People may start avoiding meals altogether, not out of choice, but because their body feels like it can't handle it. This is one reason many pancreatic cancer patients present looking undernourished and dehydrated. 7. Loss of appetite. Appetite loss isn't just mental, it's physical. Pancreatic cancer causes inflammation and releases cytokines that suppress hunger signals. This is different from stress-induced appetite changes. It's persistent and strong. Many describe it as a complete disinterest in food, even when they're hungry. In some cases, meat or fatty foods become especially unappealing. Loss of appetite often sets in early, quietly, and is mistakenly blamed on emotional or age-related causes. 8. Itchy skin, especially palms and feet. This strange symptom is often overlooked, yet it may be one of the earliest. When bile salts accumulate under the skin due to a blocked bile duct, they trigger intense, localized itching. Patients often scratch until they bruise. The itching is most common on the palms, soles, arms, and chest. It may even occur before any yellowing is visible in the eyes or skin. Persistent, unexplained itching, especially when paired with fatigue or digestion issues, deserves immediate medical attention. 9. Fatigue and weakness. This is not normal tiredness. It's a bone-deep exhaustion that lingers, no matter how much rest you get. It may be the first or most constant symptom people feel. Fatigue in pancreatic cancer comes from multiple factors: malnutrition, inflammation, anemia, and the body's energy being hijacked by the disease. If you find yourself too weak to do everyday tasks, unable to focus, or falling asleep midday for no reason, it's time to get checked. 10. Blood clots, legs, arms, or lungs. Cancer, especially pancreatic cancer, increases clotting risk. The first sign of trouble may be a deep vein thrombosis, DVT, a clot in the leg causing swelling, pain, or redness. In worse cases, a clot may travel to the lungs, causing a pulmonary embolism, which can be fatal. People with no history of clots, who don't smoke and aren't on long flights, shouldn't be forming them at random. If it happens, doctors should be screening for hidden cancers, including pancreatic. Closing thoughts. Don't ignore the whisper. Pancreatic cancer is one of the most lethal cancers, not because it's untreatable, but because it's undetected. The early signs are not always painful. They're not always obvious, but they are always important. If you experience multiple symptoms from this list, especially if they persist, speak to your doctor. Ask for blood work. Request an abdominal scan. Don't let politeness or fear stop you from advocating for yourself. Risk factors include family history, chronic pancreatitis, smoking, obesity, and certain inherited genetic mutations. If you fall into a high-risk group, screenings and early imaging may be life-saving. Don't let this cancer hide any longer. Be louder than the silence. Medical disclaimer. This content is provided for informational, educational, and entertainment purposes only, and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or a qualified healthcare provider with any questions you may have regarding your health. Never delay or disregard medical advice based on something you have read or heard here. While the symptoms and conditions described are based on medical literature, each case is unique. Viewer discretion is advised, and all health decisions should be made with the support of a licensed medical professional.